PPIE is patient and public involvement and engagement.
Bringing in the voice and the views and opinions of people who are not researchers but users of services.
Trying to make sure that the research produces answers that are useful to them.
We're really committed in the southwest to PPIE, particularly in PenARC. So we involve members of the public, service users, carers, patients, in thinking about what research needs to happen and the way it happens.
And then we meet with researchers, give feedback on research ideas, and work with researchers to provide a kind of patient and public perspective.
PenPEG is our patient engagement group.
From all backgrounds, all areas, ages, professions and everything.
This is a core group of people who are deeply involved in every aspect of our organisation.
We meet and support each other in our PPI activities. It's a way that we can communicate with the PPI team.
Just because someone's an academic doesn't mean to say that they know everything, and I don't say I know everything. If we can mix our ideas together, then perhaps we can change things together.
So the haberspace study is one of my favourite stories. We had the plans for a really big piece of work.
The project really is looking at two ways of doing hip fracture repairs.
There's a standard one that is accepted in this country and an alternative approach that can bring them back to a level of mobility closer as before they fractured.
We had a workshop with patients, and the first thing when they finished their presentation, a carer who was in a group said, "That's all good and well, but none of this is important to me and my mum."
The basis was that actually there's very little research on which way was best.
The surgeon, John Charity, who was going to lead the study, he was just so happy. He was invigorated.
John listened and he came back with a solution to my questions, and I was very excited by the fact that he actually went away and thought, well, how can I make this happen?
It's very interesting to see the insight provided by a PPI representative. I really feel that it does make complete sense because we're studying patients. Clearly you need someone who will be an advocate for them.
I have to say, it's one of the best things that's ever happened in my research career.
We have made change. I may only be a small tool within a very large cog, but sometimes the ideas that I have can change things for the whole country.
To make the healthcare system better for everybody.
It's the opportunity to perhaps improve the quality of life for hundreds of thousands, if not millions of people. I think it's phenomenal. It's the best thing I've ever done.